71% of patients said that they would trust their diagnosis more if their dentist was using AI. This was a big eye-opener for me. When we created Pearl, we didn't create Pearl as a patient engagement platform. We didn't. We created it for doctors, to assist doctors in diagnosis and practice management and this kind of stuff. What we found once we deployed it at scale was that so many people were using it to build trust with patients. AI is the worst it'll ever be right now. Tomorrow, then it's the worst it'll ever be. It's always getting better, but not without human interaction. It needs human interaction to get better.
Welcome back to another episode of Dental Marketing Theory. I'm your host, Gary Bird. I'm the owner of SMC National, where we help offices just like yours level the playing field against the big guys out there so you can grow the way that you want. But we're living in a day and age where growth is actually getting much easier. And today's episode, we're going to be talking with Dr. Kyle Stanley, who's the dentist and co-founder of Hello Pearl. And he's going to break down all the different myths, how insurance companies are using AI, how to build trust with AI with your patients, how to increase your case acceptance, and how to be a better dentist with AI. This is a really, really good episode. I learned a ton from it. If you're not using AI right now in your practice in any way, especially on the clinical side, this is going to be something that will really help you understand how things work and how patients are thinking through when it comes to AI. You're going to want to stay tuned for this one. All right, we are live, and I got round two with Dr. Kyle Stanley. He's pretty diverse because the last time we were talking about mental health and those kind of things and how important that is and his journey and how he helps dentists. And today we're going to pivot really hard in a different direction. We're going to talk about AI, which is really exciting because, to be honest with you, AI is everywhere all the time. So I feel like, Dr. Stanley, you started talking about AI like a long time before ChatGPT, before it became a mainstream thing. Is that right?
Sorry for interrupting the show, but I got something special for you. So we only got 27 more seats at our in-person event. We're going to be helping you grow in 2026. We're going to be putting together a growth map for you, helping you with attracting the right kind of team members, attracting the right kind of patients, and getting your systems in place for next year so you can actually grow. Now, this event is normally $499, but I have a discount code down below for $199. Make sure you sign up right away. There's only a few seats left. We look forward to seeing you soon. Now back to the show.
Yeah, 2015 was when I started exploring AI, figuring out how we could apply it into the dental world. Played around with it for about 2 years before we really got serious, incubated it within a previous company, and then spun out what is Pearl today, which is now in thousands of practices around the world, 120 countries, all over the world. So I've not only been able to create AI systems, but then also scale them at a fairly large scale.
Yeah, you were like way ahead of your time, which is awesome. Now, one of the things that I get a lot of times, I want us to start the show with this because I think there's a lot of dentists that are just don't trust AI yet, and there's a lot of mistrust there. Help me understand that, because like for me, I try to use AI for everything that I do. And the other thing that's kind of scary for me as a marketer, it's going to take all of my jobs, like everything I'm good at, like AI, I can see it. I'm like, it's very, very clear that it's going to take everything that we're doing. Dentistry is not so much. Like I don't see that on the dental side. Like, yes, you can get robots. Yes, you can get AI in there, but you're still going to need a human doing dentistry for a long, long time. Can you help me understand a little bit about the mistrust there?
I think a lot of the mistrust comes from the lack of understanding. People tend to lose trust in AI systems when they see it make a mistake, but they'll still trust humans that make mistakes, right? Humans are great, but we make mistakes. AI is great, but it makes mistakes. What we know is that whenever we take a human and we add AI to them, they always get better. At Pearl, we were able to show that in 9 different FDA approvals. Anytime we took a human, and they were analyzing x-rays in this case, and look and read radiographs, and then we had that same human, but we added a layer of AI intelligence, they always got better. It's like, I'm a car guy. Every modern car has some sort of self-driving, but you still need the human, right? So humans are pretty good at driving. Right? I've been driving since I was 16. I've gotten some accidents, maybe an accident a decade, right? But I'd rather have 0 accidents a decade. So when you take me, I'm a pretty good driver, right? But I still make mistakes. And you add AI to me, I'm going to make less mistakes. And so that's how we have to think about it, is it's an assistive tool for us. And yes, it makes mistakes. Yes, when you make mistakes, I think that's where most of the mistrust comes from, is the expectations are too high. We're expecting it to be perfect when it's not.
And nothing is in this world, right? There's nothing that's flawless or perfect. The driving thing is really a good example. Is that I was looking at some recent studies on Tesla and the Waymo cars and then drivers. And I have a Tesla and I use the full self-driving, and people go, "You trust it?" And I tell them it's way better than me. And I'm still need to be there in certain situations, but it's like 99% good. And the problem is like, I only have 2 eyes and they have to look in the same direction at the same time. I watched a video recently where a Tesla was at a light and it was on autopilot and the light turned green, but it didn't go. And any human would have went, but it saw a car coming through a red light going really fast. So it didn't go. And the car smokes through the red light. If it would have went, a human would have been T-boned on the driver's side, probably maybe death, but it didn't go because it could see 360 degrees. And I feel like that's AI on the clinical side, is that it sees 365 degrees. Not that it's going to always be 100% accurate, but it helps you see things that you might not see.
Well, we're seeing that all the time now. I mean, just recently, one of my friends, Savan Finkel from New York, he practices in the city. He sent me this image and it was a radiograph that he took. And he said, "What do you see here?" And I was like, "I don't see anything." And then he showed me the tooth prepped, and there's this giant cavity going through the DEJ, going into the dentin. And then he showed me the Pearl reading. He's a client of Pearl. And so he sent me the Pearl reading, and Pearl was showing him that there was something there. But both his eyes and my eyes couldn't see it. He chose to drill into this tooth, which of course is a risk. And thank goodness he did, because there was a giant cavity in there. But our eyes couldn't see the difference. Now, what's the difference in that? Our eyes can see about 50 shades of gray, the like sexual book and movie, right? 50 shades of gray. But the computer can see 700 to 800 shades of gray. So by AI finding things earlier, it's allowing us to treat things more minimally invasive, less cost to the patient, poorer, so they can have better experiences from a clinical side. And that will bring the entire profession of dentistry up when we can be less reactive and be more proactive. Let's not wait till the cavity's there and then treat it. Let's stop the cavity from happening, or let's change the habit. Let's remineralize it. There's a ton of new materials. There's a starch particle material that I'm an advisor for that we can remineralize teeth for. So if we can find things earlier, we can be less minimally invasive and give people better experiences as well.
Does it build more trust with the patients too when you show them that, hey, because I've been to the dentist and they'll be like, "See this x-ray right here? See this thing?" And they point to something and I'm just like, I shake my head yes. But
we have some research on that. There's some research showing that a huge amount of patients have no idea what you're looking at in radiographs. And let me pull this up so I can get you exact.
I would argue, like, if you showed me an x-ray and said, guess at where the cavity is, like, I see stuff on there and I'm like, oh yeah, that has to be a cavity. And it's like, no, that's your tooth.
Yeah, so listen to some of these facts. 55% of patients said trust in the diagnosis or the dentist is the most important factor in treatment acceptance, not time and not money. Okay. 64% of patients said they don't understand their x-rays during a consultation with their dentist. 87% say that it's important that their dentist uses the latest technology. And 71% of patients said that they would trust their diagnosis more if their dentist was using AI. This was a big eye-opener for me. When we created Pearl, we didn't create Pearl as a patient engagement platform. We didn't. We created it for doctors, to assist doctors in diagnosis and practice management, this kind of stuff. What we found once we deployed it at scale was that so many people were using it to build trust with patients. And so I never really even thought about that. But for all the dentists that are listening, you've had this happen where you're like, you see Mrs. Jones right here in this gray area, and you see right next to here, there's this other gray area. And you see right next to that, there's this line, and there's a third gray area where this gray area goes to this gray area, and that touches that gray area. That's the cavity. And they're like, are those my toes? What am I looking at here? I have no idea what I'm looking at. But when you add in a system like Pearl, where you say, you see this light pink area, it's going through that white and it's going into the green. The green is bad. And we don't want to get to the purple. The purple is where your nerve is. So this is one that we need to treat right now. It allows the patient to understand and own their problems. The other thing with building trust is that it is a third-party system that has no incentive to find more. This is one of the bad things. Well, I guess good and bad things that we have in dentistry. We have financially driven diagnosis. So the more I find, the more money I make. Great for me, bad for case acceptance, bad for patient trust. And again, I'm a car guy, so I think about this with my cars too. I drive 45 minutes to get my car serviced. I probably pass 100 mechanics easily. I'm going through multiple cities. It's like I'm a car guy, but you could show me a timing belt and I would be like, what am I looking at here? You could say, look, this timing belt isn't right. And I'm like, I don't know what it's supposed to look like, So I drive 45 minutes. My wife thinks I'm insane. And she's like, why are you driving all that way? I'm like, because I trust Doug. That's why. He's more expensive. He's slower. But I know that if he tells me I need something, then I really need it. And if I will sometimes come to him and say, hey, Doug, these tires are kind of looking worn. He's like, no, you got plenty on those. I wouldn't change those. You're good. Or we can wait till next year to do that. You don't really need to do that now. I've seen this many. And so trust is so important. And so I think this is one of the biggest things that AI is bringing. Third party, non-bias. Because this AI system has no incentive to find more. It doesn't get pleasure. It doesn't get paid more. It doesn't get any kind of benefit if it finds more. And so that's when the biggest takeaway.
That's really cool. So I wear a Whoop band and it like measures all my stuff. It's really cool. It helps me sleep better. It ages how fast I'm aging, all those kind of things. And it tells me a lot of information, like boatloads of information, and it's too much, right? So then I load it up into ChatGPT and I have it break it down for me. Then when I go to the doctor, I'm like, hey, doc, right? I'm a much different kind of patient with that kind of information because I have more information than the doctor has on me. They have some basic information. I have all this information. So I'm asking all these questions. I can tell some doctors love it, right? They're like, oh, this is really cool. You know what I mean? They geek out with me. I can also tell that some don't like it. And it's almost like it's almost like an ego thing. That's the feeling I get, right? You don't know, you didn't go to school as long as I did. Is there an ego play in here that hit dentists?
For sure. One of the things I always talk about in my lectures is don't take disagreement with the AI personally. And it goes back to what we talked about last time with dentists thinking that their entire self-worth and their entire identity is their profession. It's like, I went through all these years of school and, I've been out of school for 20 years and I've seen millions of x-rays and this thing disagrees with me. What the heck? Well, the thing is, it's a second opinion. You're the first opinion. So you can always disagree with it. Click off of it. It's done. That's it. Or you can allow it to say, oh, there's something here. Let me do more due diligence. And after you do more due diligence, then you can agree or deny whatever it says. But ultimately, the human is the final decision. But you're exactly right. There is a big ego with this. The best dentists working with us are the ones that have the lowest ego because they see things like, oh, they're curious about it instead of being judgmental. So, oh, that's interesting that it says there's bone loss here. I never really thought that there would be bone loss on this tooth. Oh, let me check. Let me do probing death. Let me take another x-ray. Let me talk to the patient. Let me look at their diet or when was the last time they came in. Get more data and then make a decision. The more data we have, the more fact-based decisions we can make instead of just off of emotion or feeling. And that should really appease us as dentists. We are scientists. We are like research nerds, at least I am. I love facts. You give me facts and that's how I make decisions.
Yeah. And the joke is if you take the same patient and take them to 30 different dentists, you're going to get 30 different outcomes of how they should be treated. And no one's the crazy part that blows my mind all the time is everybody's like, well, no, everybody's right. Because we all have different ways of tackling the problem. And I did a podcast about this with a dentist who is also a data scientist, trained. And the problem that we kept spinning our wheels on, because I was like, hey, AI is going to solve this. And he's like, well, AI only solves this based on whoever's putting in the prompts and the parameters that you're putting on it, right? So if you have really wide parameters to find things versus narrow parameters, then you're going to get different outcomes. How do you think through that? And I'm not smart enough to know right from wrong or up or down on that.
We actually did 3 studies on this. So let me tell you. The first one, we took one of my patients and we asked 136 doctors to diagnose and treatment plan a patient. And what we found was an extremely low agreement, just like what you said. There's one tooth that it was a 50-50 toss-up of if there was caries there or not, which is crazy, right? What surprised me even more was the full mouth treatment cost. So it ranged from, are you ready? $300 to $36,000. Now imagine you are my patient and you come to me and I say, you need a filling, it's $300. And they say, I don't really know. Let me go to his brother. My brother's a dentist too. Go to my brother. My brother says, well, there's some crowns, root canals. We got to do scaling and root planing. It's $10,000. They're like, I don't know. Then they go to my dad. My dad's a dentist too. They go to my dad and my dad's like, full mouth rehabilitation, $36,000, right? I mean, this doesn't look good for us. We did another study where we asked 3 different doctors to just diagnose caries in about 9,000 images. So find caries, circle it digitally, and we analyze it with the AI. And they only agreed unanimously 4% of the time. Now, the last study that we did was where we looked at dentists and asked them to find different things on radiographs. And then we did a washout period of a few months. I can't remember if it was 3 or 6 months. So they looked at 9,000 images, and we did a washout period where they didn't look at anything. And they did it again, okay? Unfortunately, I was part of this study. We, and me included, we only agree with ourselves 70% of the time. Now, why is that, Gary? Do you have any idea? We're human. We're different every day. I mean, if you have kids, if you have a spouse, if you didn't eat right the night before. I mean, I have a 2-year-old. Sometimes there's nights that me and my wife don't sleep, right? How am I performing the next day? Not as well as I would had my daughter and I slept, right? Or, sometimes you're driving to work and there's an accident or there's an asshole behind you that is like riding your butt and you're so annoyed and you're, oh my gosh. When you get to the practice, you're different that day. Or maybe you miss lunch. You have an emergency patient that you see during lunch. I don't advise that, but you do, and you don't eat lunch. Do you perform the same? No. So we are always inconsistent. AI is consistent by nature. So if it's trained well, it's consistently giving you the right response. If it's trained improperly, it's consistently giving you the wrong response. But it doesn't change unless it's been retrained. So it will give you the same answer 100 different times. It doesn't need to go to the bathroom. It doesn't need to rest. It doesn't need to take time off.
So did you do the same test with AI? Did you throw all those x-rays in and do the same thing and it was 100% on all of them?
Not 100% again, because it makes mistakes too. But anytime you took the AI or anytime you took a human and you added AI to them, they became more consistent too. So not only do they become more accurate, they become more consistent over time.
Remember how you said you took 90 days and waited and then asked again? And was AI consistent on that one?
Yeah, 100%, because it hadn't been retrained. What you see with most AI systems is they're constantly being retrained. So like for example, with Pearl, every 2 to 3 weeks, our doctors are getting a new model. They don't even know. It's like probably your Tesla, right? There's just automatic updates.
Learning from all the data. It's getting better, right?
It's not getting better on its own, but it's getting better through human interaction. So let's say there's a bunch of false positives, false negatives. We find them, we pay human doctors to retrain them. Then we put them into the AI system. The AI system learns from those new data points. If the new model comes out better, it's called the F1 score, then we release it. If it comes out worse, then we don't. So it's like AI is the worst it'll ever be right now. Tomorrow, then it's the worst it'll ever be. It's always getting better, but not without human interaction. It needs human interaction to get better.
Got it. Now, one of the things that I've noticed, I'll give you an example. I've had multiple times where people will reach out to me, very nice people. They're hosting an event. And they say, Gary, we want you to come speak on AI. And I'm like, great. Would love to do that. You want me to speak on clinical or marketing AI? What do you mean? I'm like, okay, so I'm not a dentist. I have no idea about the clinical side of AI. I can talk about all the marketing stuff. Happy to do that. And they're like, oh, I didn't even know that was like a different thing. Could you, for the audience, because I think there's a lot of people out there that don't realize these are like radically different sides of AI. And I think a lot of people have heard about AI with Tesla and the driving, and they've learned about AI with like ChatGPT and writing scripts and making images and things like that. And then you have Pearl. Could you explain the difference and how they're different kinds of AI?
Yeah, so there's a few different kinds of AI. There is machine learning. So machine learning is a subset of AI, and that applies computer systems that learn and adapt without following explicit instructions. Okay, so that's what most of what we're doing is. We also have things like natural language processing. So natural language processing is a computer system that can listen or hear and understand spoken word. So these are things like Siri, Alexa, that kind of stuff, right? Then you have computer vision, which is mostly what my expertise is in, and that is allowing a computer to see and understand things that are visual, videos, photos, CBCTs, X-rays, intraoral scans, right, for the dental world. That I think is probably the biggest one for dentistry because what we do is so visual. And then the last one is generative AI. Generative AI is what most people are interacting with now. So this is an AI that creates new content, like it creates new text, new images, new music, new videos by learning patterns from existing data. So there's definitely a big change. Now, I don't know if I would say it's so different whether it's clinical or whether it's marketing. It's just, what are you using it for? So when you take those 4 different types of AI, machine learning, natural language processing, computer vision, generative AI, it's just, where are you applying them? Most of the time in dentistry, we're using machine learning, natural language processing, computer vision. We're not using as much generative AI, which is like hallucinating, making things up. It is being used sometimes now. Like there's some smile design companies that are saying, take a picture and we'll show you what your teeth would look like. That is generative AI because it's making things up. And that's a big future too.
Yeah, and eventually I feel like they're all going to kind of come together. I've played around in some of these Facebook groups where a dentist will post an X-ray. Again, I have no idea what the X-ray says. I'll just slap it into chat and just say, and I'll copy. Here's how I cheat it. I copy all the doctor's answers in the thing, and I'm like, hey, write up something, pretend that I'm a dentist and respond to this post for me based on this information. And I'll post it, and dentist will be like, and I'll tell him, I'll say, I'm a marketer. I literally have no idea what this says. I just punched this into ChatGPT. This is what it told me. And people are like, holy smokes. So ChatGPT does like what you're saying.
Yeah, it does computer vision. It does generative AI. So it's like it's using computer vision in that case. It's using computer vision to listen. If you, instead of typing in, talk to it, it's using natural language processing to listen. And then the output is generative AI. So it's kind of doing, all 4 of those in one. It's like machine learning, natural language processing, computer vision, and generative AI all in one.
So cool. So let's get to the bottom line. So I realize that AI doesn't have an incentive financially. However, and I know dentists want to help people clinically. So if that's all it does and you pay, whatever the monthly fee is for it, and you can help more people, that's awesome. And you can present better treatment, that's awesome. But what's the financial underlining for dentists to use this? Because it's like, okay, you get more trust. You're going to be able to be better as a dentist and more accurate. Is there a financial upside too? Like you're going to do more treatment because people trust you more?
Even if I just told you have the same amount of new patients, but your case acceptance goes up by 20%, you're automatically going to be doing more treatment, right? And that doesn't even have to be based on AI. That just could be your communication style, right? But yeah, we've seen this all the time. And you really have it's very multimodal, meaning that you have case acceptance going up, referrals going up, you have insurance approvals going up because people are actually screenshotting what they see on the AI and sending that to insurance. You have more engagement from the team. I mean, there's so many different ways that it's raising the bar from a financial standpoint, which is really just a side effect of doing better clinical treatment and gaining more trust with the patient. What we find whenever we go into a practice and integrate is most practices have about $1 million sitting in their chart. Everyone focuses on more patients, more patients, more patients. And when you look at the actual data, like when you look at the radiographs, there's so much dentistry in your charts that either got treatment plan but didn't get scheduled or didn't make it into the treatment plan. And that's been a huge factor. I mean, even in my own practice, when we first integrated, my practice was the first practice to have it, of course. We were like, oh my gosh, there's so much stuff that we missed. Our FDA trials showed that 34%, there was 34% more found in radiographs when the doctors were using AI. And that's not made up stuff. That was all verified to be true. So previously 34% was going missed, which is wild. I didn't think it would be that high. I thought it'd be like 10%. 12, something like that. So I was really surprised at our FDA trials.
There's an incentive for the dentist to do treatment. So you wouldn't think they would, miss that much. Yeah, I totally agree. What are your thoughts on, I know insurance companies, I've been hearing this for a while, that they use AI, right? And so I've kind of heard the rumor that they're going to reject more smaller stuff, little nickel and dime things that usually wouldn't be worth a human's time to dig into. Now AI can just automatically reject it and just be like, nope, we're not doing that filling or whatever. How does this play with, I think about like drones and technology, AI with drones, right? And so I kind of see in the future, it's like, well, how do you protect yourself against drones? Well, you got to get your own drone, right? And it's like, so is that the future of AI? Is like the insurance companies are all going to be using machines, so we're going to have machines to...
Insurance companies were very early adopters with AI. We've chosen at Pearl to just be more on the dentist side of this. There's other companies that have chosen to integrate mostly with insurance companies. I'm a dentist and I'm one of the founders of the company. So I was like, no, we're not going to do that. Like, we're not going to go against the dentist. However, I was also very surprised to find, once I learned more about the insurance world, it actually means that they're probably going to be approving more. And I know that sounds counterintuitive. Why would they approve more? Because it's more expensive for them to get a review by a human than it is to approve a fee. The most expensive part of an insurance company's P&L are their dentist reviewers. So they would almost rather approve something so that it doesn't have to go to a dentist reviewer, which is crazy because, so many people are getting denials all the time. But there are things that will go all the way up the ladder to be reviewed by a dentist. And then they go, oh yeah, that's good. If that could have been approved earlier, then that would have saved them so much money. The insurance company I'm talking about. Now, here's the other thing. There are some laws in most states to where denials have to be made by humans. So in most states, AI cannot deny something. It could gather data and bring it to a human reviewer, and then the human could deny it. Yes, that's possible. But it's not just going to be automatically denying things. So I was very happy to find out that those laws exist in most states.
That's awesome. So I'm going to change gears on you a little bit. And I know we're up on time, so I'll be quick. But I have two more questions for you. So what are your thoughts on, like, you're talking to dentists out there, and I know the dentists are not all implementing this, and I know the ones that are like really excited about it. What's the reason? Like, what's their like verbal reason of like, nah, I'm not going to add that into my practice? Like, what are you hearing right now?
There's a few. There's just the idea of like, we're implementing so much new technology. We just got a scanner. We just did chairside milling. We just got a 3D printer. Like, it's just overwhelming, and I don't want to have to do more change management with my team. That's definitely one. Another one is what you talked about, ego. Like, but I've been reading x-rays for 25 years. Why do I need this?
I can't imagine somebody saying like, I'm too smart for it. But yeah, that makes sense. Like, I've been reading x-rays my whole life. So why would I do that?
Those doctors, I'm kind of like, yeah, you're probably right. You're probably too good. You don't need it. Or I say, you're right. You're great at reading x-rays. But are you great at building trust with your patients? And are you great at explaining to them what's happening and having them know, understand, and take ownership of what's happening in their mouths? Usually that's not the case. I mean, for those doctors, I would say, don't get it for you, get it for your team, get it for your patients. So that's one of the other reasons is like, so you have other type of technology. There's so much change happening in dentistry that I don't want to change one other thing in my practice because my team members are going to kill me. And the other one is ego.
Okay, last question. So 10 years from now, best guess, you might be wrong, but best guess, what is AI going to look like in dentistry?
I mean, it'll be a utility in dentistry. And I say utility just like how we think of water and power. It's going to be so unbelievably boring that it is just integrated into everything that we do. So it's listening to our conversations with our patients. It's writing our notes automatically. It's helping with scheduling patients, building trust, collecting money. I think in 10 years too, one of the biggest things is going to be assisting in treatment planning and allowing us to be more predictive for each individual patient. So we don't make these big blanket statements, meaning like every patient in my practice, if they need a crown, they get a zirconia crown. It's like, well, maybe in that specific patient, in that specific tooth at this point in their life, it should be a different material based on all the research and millions of patients just like them. So it can be more specific, more predictable. That means that we'll have less complications, less stress, which of course is a big thing for me. And patients have better experiences with the dentist. If patients have better experience at the dentist, they have less, more predictability, it's less expensive, it's more minimally invasive, it's more preventative, they're going to refer more, the entire business is going to grow, and everybody gets healthier, everybody gets better.
Yeah, everybody's happier too. Yep, that's huge. Awesome. Well, thanks for coming on. If someone wants to reach out and learn more about Pearl, what's the best way to get in touch with you?
Yeah, so if you want to get in touch with me, you just go to drkylestanley.com, or that's also my Instagram, drkylestanley. And Pearl is just hellopearl.com. So yeah, hellopearl.com is the best way, and just set up a demo and see what integrations we have and what we can do with your specific system.
Awesome. Thanks so much for coming on. Great episode.
All right. Thanks, Gary.